one of the analyses that I consider most important regarding the three-dimensional relationships involving the dimensions of the maxilla, mandible, and lower anterior facial height is the McNamara triangle. It is a subjective evaluation that does not require absolute measurements, but rather relative ones. The three structures are proportional to each other, implying that they should be assessed together. In the example from this figure, it can be observed that the measurements in millimeters from the cephalometric points condyle to point A, from condyle to point Nathian, and from anterior nasal spine to menton show compatibility, as seen in the table on the side, resulting in a balanced profile compatible with a Class 1 relationship. If the same millimetric measurements of the maxilla and mandible are maintained, and only the lower anterior facial height is modified, there will be a change in the sagittal positioning of the mandible in relation to the maxilla, prompted by the mandibular rotation centered on the mandibular fossa-condyle complex. In this example, a decreased lower anterior facial height leads to relative prognathism, not due to an increased size of the mandible itself, but rather due to the anterior displacement of the pagonium. In the opposite sense, if the lower anterior facial height is increased, leading to a clockwise mandibular rotation, it will result in a relative mandibular deficiency.